You're watching Tumor TV. Knowledge is power.
Can DNA genetic testing still be done even though the surgery was 2018? Yes. Two answers to that. So first answer, when you have surgery and tissues taken from your body, it goes to the pathology lab at the hospital at which your procedure was done, and it stays there for decades. They hang on to it. So yes, it will be there. Now, at part two of that answer is sometimes the way your tumor was taken or stored, and this is a long story, so I'll keep it really short and can answer your questions another time. But sometimes the way that tissue was removed or treated or stored has allowed it to become somewhat degraded. So we certainly have tested tumor tissue for patients that was well over 10 years old and got excellent results. So the age isn't so much the factor, it's how well the sample was cared for before it was stored properly. Did it have time to degrade? That can mean that tests will be more or less effective. The only way to answer that question is to get your test going, and then the testing facility will say, this sample is great, we're going ahead, or there's a bit of a problem. And of course, we let you know that that's the case. And if that is the case, then as Alex has been mentioning, there is this blood-based option. As I was answering before about liquid biopsies, for monitoring, you have to know what genetic mutations you have, but there is a blood-based discovery test that looks at, how many does Guardant look at? Do you remember? Is it a couple hundred?
Sorry, the Guardant?
Yeah.
And so Guardant is still within the Guardant 360 is somewhere just under 100. And the Foundation One liquid is about 315 now. So the Foundation One liquid is the one I would use.
Okay,
now.
so that's actually called CDX now. They've changed the name. CDX liquid. There's CDX tumor tissue, and then there's CDX liquid. We can help you coordinate all of those things. Point is, if we would want to start with your tumor tissue stored, because you get a little more data from tumor tissue than you do certain things you can't quite get from blood. But there is a plan B is the point here. If plan A doesn't proceed, and it takes maybe about a week or two to run through that first part of the process where your tumor tissue is collected from the pathology lab, shipped for testing, and they do the first part of the process where they can assess whether the sample is high enough quality to use for testing. So it takes about 2 weeks to figure that out. And then depending on the testing facility, it's another 2 to 4 weeks for the completed test. So altogether, most genetic testing for diagnostics is about 4 to 6 weeks.
Thank you for watching Tumor TV. Subscribe below and stay informed.